I appreciate what each of you are doing in your own separate spaces, but also collaboratively to make those changes. And what is it that needs to change? What are those things that we really need to focus on in order to see improvements and hopefully see those numbers change? Whoever wants to dive into that one.
Well, I think it starts with education. And for me, I think everything starts with education. And my prayer is that when you know better, you do better. And so I think that unfortunately there is a delta between the information that people know and what they don't know, right? And for many members in our community, they don't know that this is actually a problem. I'm going to give a shout out to Mayor Ginther in the city of Columbus, who has championed Celebrate One, and we have our director here that has done a phenomenal job thus far. But the whole reason that Celebrate One exists is because of this very conversation that we are talking about here today. And yet and still, there is still a disconnect between those champions that could come on board and help to really drive this mission home. It takes education, it takes dollars, and folks who are willing to raise awareness. But then on the other side, it's the education that happens in our hospital systems, that happens in medical school. And how are we preparing the doctors of tomorrow to provide care that is individualized, that is not based upon their own biases, whether they're perceived or not, so that they can confront those issues and be able to provide the best care to the person that is sitting in front of them. I have been on the receiving end of those perceived biases far too often to not be able to sit here in front of you today and say that medical racism absolutely exists, right? And I know that the care that I would have received had my skin color been different would have been different, right? And I could have a different result sitting before you today. And so it's important for everybody that's on this couch and those who are watching to educate themselves and figure out what they can do to change these disparities in our community.
I just wanted to piggyback on that because you mentioned the collaboration and connection that needs to happen. And so certainly education is important, but a pregnant family encounters so many different systems and so many different pathways throughout the course of their pregnancy. And those pathways are largely unconnected to one another. And so there are many opportunities for families to fall in between the cracks of each system. And so really our goal at Celebrate One is to bring that collegiality and bring that collaboration and that connection between those systems so that there's a smooth transition for families from conception through delivery and beyond.
Yeah, absolutely.
And I'll just say too, I think conversations like this are important because you can't address something that you don't discuss. Mm-hmm. And having the dialogue, I think, is a huge step. And many folks see that as inaction. But really, we have to have a dialogue around this because it is not a silver bullet. It is a system that we're talking about, and it's a holistic approach that we have to address when trying to tackle it. But one of the biggest things I know I can say is how do we get families the resources that they need, that they feel empowered to ask questions, empowered to challenge, empowered to really make those decisions for themselves. Our medical industry, and you think about other industries like fire and police, these are all industries where we give authority and we trust those folks because they are the experts, they're smarter than us. And so there's this fear sometimes to question what they're saying, or there's this fear to not ask any questions because I don't know, I'm not a doctor, right?
Right.
And so, but if we can, I think, rip that veil and make that process really a process where doctors and the system is working hand in hand with families to make sure that they have the outcome that they want to see, then I think we'll see better outcomes. And so at the end of the day, I think it's empowering families, empowering women, but more importantly, listening to women. Women know their bodies. Women know what is going on. And so we have to make sure that we have a system, regardless of healthcare, all across the board, where we are listening to women and what they need.
And I would echo what everyone said, but just emphasize that this is not a silver bullet. You know, this is a multifaceted approach that we do need the education. We need strong providers that understand there is medical racism, but there is racism in our community. And what we have to realize and address is how that racism impacts people, their jobs, which affects their income, their housing, the education they get from pre-K to kindergarten on up, the knowledge they get about reproductive care, how you get pregnant. I mean, we have youth today who are having sex who don't even understand the basics of what sex does and how that can impregnate somebody. So it's really multifaceted, and the social determinants of health, the healthcare system, empowering people, having support during a pregnancy, like with doulas. I think that's really important, and we don't talk about that enough. And you know, what we're seeing, particularly with maternal health, is something that has been going on for years, unfortunately. My paternal grandmother died in childbirth. That was accepted in some ways back in the early 1900s, right? Particularly if you were of color, because you couldn't give birth in a hospital. But now, because of social media, we have celebrities and famous people sharing their stories and bringing voice to what some of us have known has been happening kind of underneath the surface for many, many years. And I appreciate them bringing that story to light so that we can sit here and others can talk about it, and hopefully we can prevent the next one from happening.